Hello, everyone. My name is James Callahan from the Michael Garron Hospital IPAC team. I want to thank you for joining us today and welcome you to another LTC CIP group lecture. Today, we have a presentation from Nicole Augustin, who will be presenting the 7th lecture in our series, Cleaning, Disinfection, Sterilization of Medical Equipment and Devices and Equipment. Nicole is an infection control practitioner from Scarborough Health Network and has a background as an emergency room nurse for over a decade. Nicole's area of focus is supporting long-term care homes with their IPAC programming. With that, let's start the lecture, and I'm pleased to hand over the presentation to Nicole, who will take us away.
Thank you, James. Hopefully everyone can see my screen. Hello, everyone, and welcome to session 7 of cleaning, disinfection, and sterilization of medical equipment. It will just be over close to a year since I joined infection control, so I'm still working on getting my certification. I started in acute care and transitioned to the hub about 7 months ago. I work with amazing colleagues here at SHN. I have 2 young ones that keep me very busy and occupied, so I have to study smart and effectively. Every minute counts for me, and every tricks I can use to maximize in getting these materials to stick into my head are very important. Moving on to the next slide. As per CIVIC, there will be about 15 questions related to cleaning, disinfection, sterilization. Number 1, it includes practices based on intended use, such as Spalding classification. Number 2, methods of cleaning, disinfection, and sterilization. It is a lot of content that I personally found difficult to understand in the beginning because of the amount of details and wording I was not familiar with. In addition, it's not something that I use in my daily practice. My goal is to give you some techniques to help you memorize, going back to the previous slide, the types of cleaning, disinfection, and sterilization so you'll be ready for the exam. Study tip, gum. Did you know that chewing gum increases blood flow to the brain, increases oxygen to the brain, which can help enhance your memory and cognitive performance? Here, I created a table that made it easier for me to divide the different types of cleaning, disinfection, and sterilization. I'll be going over this table again in my next slide whenever I discuss each topic. First, let's get to cleaning. Oh, I'm experiencing some technical difficulties here. My slides are moving a bit faster than I want it to be. What is cleaning? It's always the first step, has to be done right away. Cleaning is the physical removal of dirt, bodily fluids, or other organic matter from a surface equipment. You want to clean the instruments right away because when you have, for example, blood or tissue on the medical equipment, they dry up and it becomes very difficult to remove, which can make disinfection and sterilization ineffective. So after all those gunky, gross stuff is removed from the medical instrument, that instrument should be kept moist prior to transport for further cleaning, disinfection, or sterilization. This can be accomplished using special containers, pre-treatment products, or towels moistened with water and not saline. Why? Because saline can actually be very corrosive and can damage the instruments. You want to be able to transfer disclosable, puncture-resistant, leak-proof containers marked with biohazard. Oops. Cleaning. Cleaning can be divided into 2 categories. Manually. Let's talk about manually. Why would you want to do manual cleaning? It's that area doesn't have mechanical unit or when you're dealing with fragile or difficult to clean instruments. Cleaning manually, remember the 2 F's, friction and fluidics. Friction is the rubbing and scrubbing, aka elbow grease, the old school way of cleaning. When I think of friction, I think about cleaning my bathroom. Fluidics are fluids under pressure, can be used after brushing or when the design does not allow brushing. What this means is if there's an area where a brush can't reach, you can run fluids in high pressure. This reminds me whenever I have to clean a dirty straw and I don't have the brush that can fit in that straw. Next slide. Cleaning mechanically. This part can be very intimidating, and hopefully the graphics will give you a better sense of what I'm going to be discussing. Ultrasonic cleaners are ultrasonic waves that remove soil by cavitation and implosion through acoustic wave energy, there's actually fluid inside this ultrasonic machine, and that fluid doesn't have any antibacterial claims. So it's important to note that the solution inside in these ultrasonic cleaners may have bacterial contamination. In addition, the fluid inside could result in endotoxin contamination of surgical instruments that can cause severe inflammation. Washer disinfectors reminds me of dishwashers. They use water and detergent to remove soil from instruments. They are generally computer-controlled units for cleaning, disinfecting, and drying solid and hollow surgical medical equipment. Washer decontaminators, similar fashion to a washer disinfector, water circulates and detergents to remove soil, but can also have a heat process for 90 degrees Celsius for 10 minutes. The last one are washer sterilizers. Here is a photo, and as you can see, it's quite huge. Washer sterilizers are modified steam sterilizer that clean by filling the chamber with water and detergent through which the steam passes to provide agitation. Instruments are subsequently rinsed and subjected to a short steam sterilization cycle. Another washer sterilizer employs rotating arms for a wash cycle followed by steam sterilization at 285 degrees Fahrenheit. Next slide. Cleaning solutions. We have neutral to near neutral pH, enzymes, and alkaline base. The best choice for instrument cleaning and best material compatibility is choosing a cleaning solution that's neutral to near neutral pH. CDC recommends this as it's less likely to corrode or otherwise damage the instruments. Enzymes, usually protease, are sometimes added to the neutral pH solutions because they're more compatible with metals, other materials, and it's the best choice for cleaning delicate materials such as your flexible endoscopes. Cleaning solutions can also contain lipase, which are enzymes that are active on fats, amylase, which are enzymes that are active on starches. The most important thing to remember about cleaning solutions with enzymes to rinse. It's important to rinse because it removes any of those residual enzymes because this can cause adverse reactions that can affect the users. Alkaline-based cleaning agents are also used, and they're used for processing medical devices to help dissolve the protein and the fat residues. Again, however, this can be very corrosive. We're going to get to our first question. Number 1, the purpose of cleaning medical devices before sterilization or disinfection is to A, reduce the bioburden, B, add an additional step to the process, C, replace the sterilization process, D, increase the amount of time it takes to clean an endoscope. Give you guys some time here. And the correct answer is A. Cleaning reduces the bioburden, which interferes with the sterilization process because these bioburden can sometimes act as a barrier to the sterilizing agent. Next question. Ultrasonic cleaners are used for A, removing gross soil from an instrument, B, high-level disinfection of instruments, C, sterilization of instruments, D, fine cleaning of instruments. And the correct answer is for fine cleaning instruments. When I actually tried to answer this question, I actually got it wrong. Initially, I thought it was removing gross soil from an instrument. But when you're removing gross soil, what you want to do is you actually want to wipe it down and use an irrigation process as opposed to an ultrasonic cleaner, which only fine cleans the instruments. Our next topic is disinfection. My study tip for remembering the different types of disinfectants is using mnemonics. Mnemonics are systems and tricks that make information memorable. When you start studying terms you've never heard of or not familiar with, it can be quite difficult to make it stick to your head. I was personally struggling myself when I was trying to study these chapters, hence why I came up with mnemonics. This is the mnemonic I came up with that works for me, which helped me answer some of the practice questions, and hopefully it will help you guys too. So after cleaning comes disinfection sterilization, and this is where Spalding classification comes in. It is the primary principle that guides disinfection and sterilization processes. This is a very important table to remember. It categorizes equipment as critical, semi-critical, non-critical, and depending where they fall, it will tell you what kind of process you need to use in order to clean, sterilize, or whatever type of disinfection you have to use. Association for the Advancement of Medical Instrumentation, AAMI, designated environmental surfaces as the fourth category. So let's get to the Spalding classification. Critical. So critical items, they're equipment that enters the sterile tissue. And the process that you want to use is sterilization. Sterilization destroys all microorganisms and bacterial spores. Examples would include surgical instruments, urinary catheters, and implants. Critical items, you want them to be free of any microorganisms and spores, because when they enter a sterile tissue, bone, or your vascular system, you want to prevent the introduction of microorganisms that can cause infections or disease. Next is semi-critical. Those items contact your mucous membranes as well as non-intact skin. And you want to use high-level disinfection. High-level disinfection destroys all microorganisms and some bacterial spores. Examples would include your respiratory anesthesia equipment, as well as some of your GI equipment. Semi-critical items that come into contact with your mucous membrane are intact mucous membranes, such as those of the lungs or your GI tract. They're generally resistant to infection caused by the common bacterial spores, but they're more susceptible to organisms such as your bacteria, mycobacteria, and viruses. Non-critical equipment that comes into contact with your intact skin. You want to use intermediate level disinfection, which does not destroy bacterial spores, or low level disinfection that does not destroy mycobacteria or bacterial spores. Examples would include your blood pressure cuffs, pulse oximeter, bed rails, and furnitures. Intact skin, they act as a barrier to most microorganisms, so therefore sterility of items coming into contact with the skin is considered not critical. It can be divided into two categories, which includes non-critical patient equipment, as I mentioned, like your blood pressure cuff, or non-critical environmental surfaces, such as your bedside furniture, counters, and sinks. Here I have a table that explains details of sterilization. And sterilization destroys all microorganisms, including the spores. When you get to the disinfectant, this is where you differentiate the spores. With high level, you destroy all microorganisms except a high number of spores. Oops, let's just go back to that slide. With intermediate level, you destroy vegetative bacteria, mycobacteria, most viruses, most fungi, but not bacterial spores. With low level, you destroy the vegetative bacteria, some fungi and viruses, but not mycobacteria and not bacterial spores. So I found this table very helpful, and I think this table is from the LTC CIP study guide. So now that we know the Spalding classification and the types of organisms / spores are destroyed, let's dig into disinfection further. It's done after a surface has been properly cleaned. The purpose is you want to eliminate, with the exception of spores. Residual organic matter such as blood can inactivate disinfecting agents. Disinfection involves wet pasteurization or liquid chemicals. Factors that affects its efficacy includes biofilms, how the instruments were cleaned, how the correct concentration, solution, temperature, and the nature of the object. Biofilms, by the way, are micro that attach to the surfaces that are immersed in liquids. Once these masses are formed, microbes may become resistant to these disinfectants. So cleaning the instruments again right away and reprocessing by either a high-level disinfection or sterilization, biofilms will not have a chance to form. So going back to this table I created, disinfection is you have the high level again, which is either pasteurization or you immerse it in liquids. And then you have intermediate level and low level, which are generally liquid contact. And these are all the types of liquid disinfectants. Quats, also known as quaternary ammonium compounds, peracetic acid, O4 orthophthaldehyde, OPA, I hope I pronounced that correctly, P or phenolics, I for iodophores, hydrogen peroxide, alcohol, chlorine, glutyraldehyde, and formaldehyde. That was very wordy. So how did I remember all these disinfectants? Let's start with the word Q-pop. So if you've ever heard of K-pop, which is the Korean pop band, there's also Q-pop, which is a type of Asian pop band in Asia. Q stands for your quats, P stands for your peracetic acid, O for your OPAs, and P for phenolics. The next word I have is key, which is QI over here. If you play Scrabble and you have a letter Q or an I, QI is an acceptable Scrabble word. The reason I remember this is because it's a word that my opponent used, which caused me to lose. It means the spiritual force or vital energy that animates all living things. Next mnemonic I have is HPAC. HPAC stands for heating, plumbing, air condition, but for me, it stands for hydrogen peroxide, alcohol, and chlorine. Next word that I have is fog. Fog stands for formaldehyde, orthophthaldehyde, and glutyraldehyde. And the reason I created the word fog is just for me to remember that all these three FOGs all end with dehyde. Next, this is a great table from text chapter 31 that divides the types of disinfectants. Here, again, high-level disinfectants destroy all microorganisms except you're still left with a high number of spores. It could be heat automated, which is pasteurization, as we saw earlier, or it could be immersed in liquids. And the liquid, just to let you know that some of the high-level disinfections can also act as a chemical sterilants, which I will discuss in the next slide. Examples would be your glutyraldehyde, OPAs, hydrogen, them are in combination, hydrogen peroxide with chlorine. Examples of equipment that you can use are heat-sensitive semi-critical items such as respiratory equipment. And for liquid immersion, it includes semi-critical items such as endoscope. Intermediate level disinfection, again, destroys vegetative bacteria, mycobacteria, and most viruses, but not spores. It has to be EPA registered because this is the material is actually based in the States. EPA registered hospital disinfectant with a label claim regarding the tuberculocidal activity. They tend to be chlorine-based, phenolics, and improved hydrogen peroxide with at least exposure times of at least 1 minute. And you can use it on non-critical patient care items or surfaces with visible blood. Next one is low disinfection, and this is the lowest level. And again, it doesn't destroy mycobacteria or bacterial spores. Same thing, it has to be EPA registered, as well as the other products, by the way. Exposure times of at least 1 minute. This tends to be chlorine based, improved hydrogen peroxide, phenolics, quats, and alcohol of 70 to 90%. Again, it's cleaning non-critical patient care items or surfaces with no visible blood. Things to consider when selecting cleaning and disinfecting products, consider kill times, which include information about the organisms that the product actually kills, contact time, which is how long the solution must sit in order for it to be effective, the time before the equipment can be used again, hazard information, which includes on the labels, like the potential hazards such as, hey, do not ingest bleach, or whether or not this product is corrosive, or if there's any PPE that is required when handling this product. Select the lowest recommended contact time whenever possible. CDC notes that the contact time of at least 1 minute is sufficient for low-level disinfection of non-critical items and surfaces. Some products, however, recommend contact times of up to 10 minutes. However, this requires multiple and impractical reapplication of the disinfectant, as most solutions are water-based ones and they normally dry up in 1 to 2 minutes. For example, you wouldn't want to give the nurses a disinfectant to use on a blood pressure cuff that has a contact time of 10 minutes. Because otherwise, if they have 20 residents, that means in 1 hour, they can only take blood pressure of 6 residents because they have to wait 10 minutes in between usage in order to take blood pressure of the next resident. Getting into our question, under the Spalding classification, non-critical equipment such as blood pressure cuffs require high-level disinfectants. B, low-level disinfectants can be used to disinfect the bedside table, even though it does not destroy spores or mycobacteria. C, high-level disinfectants should be used in surgical instruments. D, semi-critical equipment requires disinfectants such as quats and alcohol that is 70 to 90%. Give you guys some time. And the correct answer is B. A is not correct because non-critical equipment, you don't need a high level. Low level is fine because surgical instruments require sterilization. D is not correct because semi-critical items are high-level disinfectants, and also quats and alcohol are considered low-level disinfectants. Question 4. Oops, oh my gosh, so sorry. I gave you guys the answer already, but let's go over it anyway. An infection control practitioner observes a nurse using scissors on multiple residents to remove dressings without cleaning or disinfecting in between uses. Which of the following describes the proper procedure that the nurses should have followed? And the correct answer is C, scissors must be cleaned and disinfected with a proper chemical before being used on another resident. Okay, I think my fingers are getting very slippery here. Question 5. Which of the following items can generally be reprocessed by only using low-level disinfectant? This is very easy. A, blood pressure cuffs. B, anesthesia equipment. C, bronchoscope. D, surgical equipment. And the correct answer is A, blood pressure cuffs. Next topic is sterilization, and my study tip for you guys is give me a break. Brain can only absorb so much information, and taking breaks will help you retain more information. So make sure you get up sometimes and eat a Kit Kat bar. Let's bring back this table. Again, sterilization destroys all microorganisms, including bacterial spores. And again, sterilization, you use it on equipment that enters sterile tissue that are considered critical. Sterilization can either be physical or chemical. Steam sterilization is the oldest and most effective and is the preferred method. Sterilization, however, is not commonly conducted in long-term care. And even though it's not common in long-term care, there are sterilized products used in LTCs. LTCs must know how to store, transport, distribute, and use sterilized products. It's basically a matter whether or not whether staff know how to use sterilized products or how to dispose it appropriately if it has to be sent out. An example of sterile products that are commonly used in long-term care are your Foley catheters and some wound dressings. Here we go back to this table I created. Again, sterilization, you're dealing with high temperature, which is steam under pressure. And again, this is the best method, and followed by dry heat. Low temperature, when it comes to low temperature, you start to add gas or vapor, which includes hydrogen peroxide, ethylene oxide gas, ozone, also known as blue gas. Liquid sterilants, also known as chemical sterilants, that's where you have the glutaldehyde, hydrogen peroxide, and peracetic acid. Back over here. High temperature, heat tolerant critical surgical instrument, and steam. You would need a temperature of 250 to 272 Fahrenheit. As mentioned over here in this table, again, this is from the APIC text chapter 31. High temperature includes steam and dry heat. Steam is not toxic to the patient, staff, or an environment, which is an advantage. One of the disadvantages of steam is that it's detrimental for any heat-sensitive instrument. And if instruments are left wet, there's a chance for rust. So if you look at the wording here of an example, when it comes to high temperature, the only equipment that you can use are those that are considered heat tolerant. When you go to low temperature and liquid immersion, looking at the wording is heat sensitive. Okay, so just always pay attention. Low temperature, as I mentioned, you start to use, for example, gas or vapor. And here is an example over here in this table. Ethylene oxide gas is compatible with most material. However, it's also carcinogenic and flammable. Liquid immersion. The main disadvantage is that it cannot be wrapped during processing, so maintaining sterility can be a challenge. And it also has to be rinsed off. An example is a hydrogen peroxide. Hydrogen peroxide may enhance removal of organic matter and has no odor or irritation issues. However, there may be concerns for compatibility with brass, zinc, copper, nickel, and silver. In addition, it causes severe damage to the eyes. Storage of sterile equipment need to be at least 3 feet from sinks, 8 to 10 inches from the floor, 18 inches from the ceiling, and at least 2 inches from outside walls. How I remember these numbers is I think of the bottom being low. So I know it's 8 to 10 inches, and the number above tends to be higher, which is 18. Sometimes what I do is I go like, okay, I only need to remember 1/8. So 8 plus 10 equals 18, which is the above number. Let's get to our question. Question 6. Critical that are heat sensitive in A, can be processed with an intermediate level disinfectant. B, does not require cleaning because it can ruin the instrument. C, can be processed with chemical sterilants. D, can only be sterilized with a hot. And the correct answer is C, can be processed with chemical sterilants. Heat tolerant items are the only one that can be steamed or processed with dry heat, not heat sensitive. Correct storage to maintain the sterility of reprocessed item. Hopefully you guys remember my table and are able to answer this question. A, at least 12 inches below the ceiling and at least 6 inches above the floor. outside wall and on a rack with a solid bottom. B, at least 18 inches below the ceiling, at least 6 inches above the floor, at least 1 inch from the outside wall, solid bottom. C, at least 18 inches below the ceiling, at least 8 inches above the floor, at least 2 inches from the outside wall, and on a rack with a solid bottom. D, at least 18 inches below the ceiling, at least 8 inches above the floor, at least 1 inch from the outside wall, and on a rack with a solid bottom. And the correct answer is C. Emerging technologies. Do you have ultraviolet UV irradiations, which are less effective against bacterial spores? At present, it's limited mainly to destruction of airborne organisms and inactivation of microorganisms on surfaces. There's antimicrobial coated surfaces. They're normally heavy metals. Copper and copper alloys are well documented antimicrobial properties, as well as silver and zinc. Hydrogen peroxide vaporization and aerolization. Using HP vapor is a lengthy process, 4 times longer. However, it is highly effective for eradicating various pathogens such as MRSA, tuberculosis, serratia, and C. diff spores. There's also no-touch methods for decontamination, either UV or hydrogen peroxide. They supplement, do not replace your standard cleaning and disinfection before deploying a no-touch disinfection. Our last topic is environmental cleaning. Why clean environmental surfaces? There is excellent evidence in the scientific literature that environmental contamination plays an important role in the transmission of several key healthcare-associated pathogens, including MRSA, VRE, or C. diff. Contaminated surfaces in residents' rooms can act as reservoirs. These pathogens can days and in some cases months. More importantly, environmental transmission has been associated with outbreaks. Environmental cleaning, there are 2 categories. One is high-touch areas and the second one is other surfaces/items. High-touch areas require frequent cleaning due to the higher risk of contaminations. These are, for example, your handrails, light switches, doorknobs, and some electronics. Because these items are frequently touched by, for example, potentially colonized or actually infected person, you want to clean these things right away and also frequently. Number 2, other surfaces items. All other surfaces and items require less frequent cleaning, partly because they pose lower risk as being a source of infection or transmission. Environmental cleaning, evaluation, and improvement. Key methods to determine if cleaning and disinfections are done cleaning and disinfection is completed effectively. The EVS department is responsible for ensuring that the staff are providing quality cleaning and disinfectant, and the infection control practitioner, however, they're responsible for evaluating the cleaning and disinfection, and this is best conducted through observation, either direct or indirect. And the second one is environmental monitoring, which I will discuss in the next slide. It's also important that timely feedback and improved education, they are the 2 most effective responses to any gaps or errors discovered. So when you're doing audits, you see somebody committing an error, it's important that you correct them right on spot and not a week later, because they're not going to remember what they did. Through observation, we use checklists. Checklist is a valuable tool and can be incorporated when the IP does their round or any do rounding in the units. The above checklist, it can be modified to evaluate whether or not the EVS staff is diluting the solutions or the disinfectants correctly. Also, whether or not they're following the recommended contact times. And also a good method to see whether or not the products being used in the facility are environmental monitoring. There are 3 approaches. culture, which is best suited for an outbreak. You conduct this with a collaboration with a public health. It's not recommended for routine monitoring, which is environmental culture is when you collect a swab using your general culture swab or agar slide technique. The second one is adenosine triphosphate bioluminescent assay. It's used after a special environmental surface swab. It highlights and measures the residual organic debris used to assess the efficacy of cleaning. The third one is fluorescent marking. First used to assess hand compliance with hand hygiene. It's inexpensive, reliable, and immediate feedback on cleaning processes. As I said from before, doing this chapter, there's a lot of like wording that I'm not familiar with and also difficult to pronounce. Let's go to question. Following statement is false. EVS staff should ensure disinfectant being used to clean a room is appropriate. B, cleaning procedures begin in the most soiled areas and progress to least soiled from low to high touch air surfaces. C, using the warmest appropriate water for laundry. D, cleaning procedures begin in the least soiled areas and progress to most soiled from high touch to low touch surfaces. Gonna give you guys some time. Answer is B, meaning it's a false statement. Question 9. EVS staff should use clean equipment and supplies. Cleaning cloths such as mop heads should be A, discarded as they are only single use. B, put in the dryer for 6 hours after being treated with bleach. C, treated using a detergent, then placed in a 2-hour drying cycle at 80 degrees Celsius. D, submerged peroxide or quads for 30 minutes, as this has been shown in removing microorganisms. I did not discuss this in the exam, and the reason I put this question up is because when you write exams, you're going to come up, you're going to get questions. Oh my gosh, I just don't remember reading this. So just kind of getting you guys prepped. And the correct answer is C. I did get this information from the APIC text. It's not something I made up. So question 10, which of the following statement is true? A, dust can contain fungal spores. B, wet dusting horizontal surfaces does not reduce risk spreading dust. C, microfiber cloth have a lot of disadvantages and should not be used in healthcare. D, petroleum-based products do not pose a fire risk when high heat methods of cleaning is used. And the correct answer is A. Dust can actually contain fungal spores such as aspergillus. And B, EVS should actually try to minimize turbulence by and wet dusting using a moistened cloth with a small amount of EPA detergent/disinfectant. C is false because microfiber is the preferred material for cleaning in healthcare settings. It's also more absorbent than cotton and can be wet with disinfectant. D is false because petroleum-based products pose a fire risk when high heat method is used. So for my last study tip, here is a quote that I use. Do something that your future self will thank you for. There are times where I'd rather just stay in my nice warm bed or continue to watch useless content on my phone. When I contemplate whether or not to stay in my bed or even study, even if it's 30 minutes, I say this quote and it motivates me to make the right decision because I know if I get out of my bed and study for 10, 20, or 30 minutes, my future self will thank me and it'll be a lot easier and I'll be a lot closer to where I need to be in terms of my goal. Thank you everyone for your participation. I hope you find my presentation very useful. And here are my references. Again, I used APIC Text Online. The main chapter I use is chapter 31, which has those great tables. I also use the LTC CIP Online only. I also use the CIC Certification 6th edition study guide, and also some content from the CDC. Thank you.
Great. Nicole, thank you so much for that excellent lecture. And I just want to take a moment to highlight some of the things that I really appreciated. One, right off the bat, you mentioned that you've got young kids and challenging can
Yeah.
be studying can be challenging, and making sure you have time for that and doing it smart is essential to doing this. And it doesn't mean that you can't do this at this time. I also really appreciated your application of the content into real life situations in the LTC, like giving examples about just-in-time feedback for the staff. And the language to describe a lot of this stuff is very challenging. It's a mouthful, and I thought your mnemonics, your little tricks, memory tricks, are a great way to remember it. So, just want to say thank you. You made the content for me very clear. It's clear that you understand it very well, and really appreciate your time and energy that you put towards helping all of our IPAC leads in LTC obtain their designation. Thanks so much.
Thank you, James.
Okay, bye.